Hello. Part two of my video. If you watch part one, this is part two. I step in again to talk about nursing assessment. It's a continuation of care. When you take over, make sure you do a thorough assessment. You know, when you get report, you ask the previous nurse how this patient came in. Is this patient verbal or non-verbal? you know how is the cognition of the patient, the orientation of the patient, how was the patient able to walk, talk, feed themselves. So those are some of the things you ask. You're asking those questions because you want to know if there's a difference, if there has been a decline on this patient since the patient came in. So while assessing your patient, you do your head to toe assessment for your patients every day on your shift, because there can be a change within a second for that patient. When you come on your shift, even you work with that patient the previous day, make sure you still do a thorough assessment. You see if there is any change from the previous day when you work with that patient. You talk with that patient, see how they respond, if there is a change in their responding to you. Um, do your eye gaze, see how it goes. Ask them to move their hands. Sometimes a patient can be in bed having a stroke or had a stroke, you don't even know. Ask them to pick up their hands, ask questions, how you feeling, what's going on, any change in your health, and see how they respond. Ask them to pick up their legs and always check the skin because of breakdown. The patient that stays in bed for 2 3 days is at high risk of developing pressure injury because most often they don't turn. That's why you make sure you check your patient. You can help turn your patient from side to side using a pillow. That help increase circulation, you release pressure so they don't develop pressure injury. So you don't want to be that nurse that you each time you get an assignment and before you know it a patient develop pressure injury in the hospital before being discharged. You have to check their skin, turn, look at the back, look at the heels, and encourage your techs, encourage your CNAs to turn that patient if you don't have time to get to do that. Encourage them to reposition that patient using a pillow, floating the heels, and document your assessment every day on your patient. Document how that patient is, if there was any change, and make sure if you see any change in vital signs or in any cognition or physical ability of the patient, make sure you communicate with your doctors right away and implement orders right away. If you take a blood pressure of your patient, or if your CNA tells you a blood pressure of this patient is low, you go and recheck the blood pressure, and if it's low, you make sure you contact the physician and get an order right away to take care of that. So that's the main purpose of a nurse. You are at bedside with this patient, you are the one to see all the changes right away and communicate with the doctors right away to implement orders right away to save the patient, the life of this patient, and keep this patient back to a state of good health. So always focus on doing your assessment daily. Know how your patient is doing. Know if your patient is improving. Administer your medication timely, on timely, in a timely fashion. If you have antibiotics that are scheduled every 6 hours, make sure you give them every 6 hours. Antibiotics are never too good to give an hour later. You give your antibiotics on time. You collect your blood draw for therapeutic drugs. You collect your blood draw on time. You follow the facility protocol on your levels, and do your blood draw and follow up with the doctors for updated orders. So I just asked you follow up on this because somebody asked a question on nursing assessment. If a patient is having a change in condition, yes, the nurse is in charge of that. You have to assess your patient for any change of condition and notify the doctor. You have to implement those orders as they're coming in, implement them on time, administers all those medications on time. If your line is infiltrated, get a new line right away. Don't uh, don't delay because you don't have a line to administer this medication at this time. No, you don't wait. You have to uh, get a new line in and administer your medications. You have to be on top of your game. I would say your game, because that is your game. You have to play it well to make sure your patients are well and back on their feet and be discharged. And the next videos, I'll be talking about other things like discharge planning for a patient, or patients that are going for a surgery, some of the things that you look at as a nurse. Thank you for listening. Send in your comments so I can come in and be answering your questions. Thank you.